involved right away?
We do have a structure. We knew who was in charge and what were the next steps, but it was not a big plan that was in writing. Since that time, the Ag Center has developed what we call scoops or business continuity plans, and these plans work with, who are the contact information for the faculty and staff, what is the triage, what are the necessary people to be available immediately after a crisis or to keep business continuing.
The important thing that you have to do in a crisis is you have to all be on the same page. You have to agree, well, I don't know if you have to agree, but at some point you have to reach consensus about what has to be done, and who does what has to be determined. That falls into place, and probably it should be written down. So I guess I am a proponent for written plans, just not 40 pages and gathering dust on shelves.
Plan ahead. And it's not until you have a disaster do you realize that you didn't have a plan or you didn't have things in place to educate people, make people aware of disaster preparedness.
What happened in Baton Rouge and New Orleans and throughout the Gulf Coast last year in 2005 was unprecedented, and we felt like it was important for us as public relations researchers and educators to talk to professionals and find out what they learned. You can study about crisis communication, but we had people in our community who had dealt with a huge crisis issue, and we felt like we needed to see what their experiences were like and what they learned. So we conducted interviews with 14 public relations professionals in Baton Rouge and New Orleans. Their perspectives, they were from agencies, typically government agencies and public service corporations that were significantly affected by Hurricane Katrina. Whether it be their employees or their customers, there was a huge impact for their organization. And we wanted to know from them what their experience was like, anecdotally, what was life like in the days that the storm hit, days to follow. How did they balance professional obligations with personal crisis that was happening? And we wanted to know from a theoretical perspective regarding public relations how they balanced accommodating their publics, the needs of their publics, with advocating for their organization, being representatives of their organization and making sure they were garnering favorable coverage in the media. So how they balanced those activities, and from a crisis communications perspective, how did they have a crisis communication plan? Did they use it? What did they learn? What did they wish they had done before the storm? And so we asked them a lot of those kinds of questions as well. For most of the professionals, their internal communications went very well. There were some things that didn't go so well. One example that we found out from the gentleman was just a technical issue. He had email filters set up on his computer to send any email messages that were from unrecognized addresses to his bulk email folder. So when emails started pouring in, media requests from the BBC and the New York Times, and people he didn't normally hear from on a daily basis, those went to his bulk email folder, and in the first week he wasn't responding to these really significant media requests. Another thing that in general didn't go very well for some of the people that we talked to was just handling media requests. The large amount of media requests, they weren't used to dealing with so many. They did fine with local media. They had great relationships established with their local media. They were able to use local media to correct rumors and misinformation. One gentleman we talked to said local media gets it. They knew what we needed to get out, and we could just go right in, knock on the door, and sit at the desk and get the information out quickly. National, international media, press briefings that they had on a daily basis, some of the information that the media wanted, they weren't able to provide. The media wanted access to New Orleans. They wanted to interview evacuees in shelters. They wanted to know how many dead bodies had been found or how many people lost their lives far before people were able to establish those numbers. One message that you heard over and over again from everyone from the governor of Louisiana down to whatever PR representative was making a statement was compassion, concern for people who lost their lives, and that's really important. I think in a crisis situation, you can get so focused on, we need to get this information out, we need to make sure people have these phone numbers, that you might forget to say, we're really, we keep in our thoughts and prayers, or we're really thinking about these people who have lost their lives. And it's important, we all have that compassion. It's important to show that compassion, that you are a caring organization, and that, particularly in terms of your employees, that you are concerned and you want to be there and help them. Beyond that, I think the key message for all of these professionals was information. People were starved for information. If I was helping someone set up a good crisis communications plan, there's a couple of key things that I would have in the plan. First of all, media contacts. You have to know who your local media contacts are, and you need to know that person. You need to have a relationship with them, particularly with radio. That was one thing we found in the study. Radio was the medium of choice after Katrina. People didn't have power, they weren't getting the newspaper, they couldn't get online, but everyone was listening to the radio. And a lot of the PR professionals that we talked to hadn't really dealt with radio at all. They didn't have established contacts with radio. They were kind of nervous about doing live radio feeds, about what kind of questions people would ask. So train people to deal with radio and make sure you have good established media contacts. The second thing I would say is you have to have a designated spokesperson. You have to have somebody in your organization who knows how to talk to the media. They're ready. They have a code on the back of the door they can pull out. They're ready to talk to the media at all times. While it's important for you to have a designated spokesperson, everyone in your organization needs to have some media training. Especially in a crisis, the media are going to come in and they're going to ask questions of whoever they can find to ask questions. So your employees, if they haven't gone through full media training, they need to know what they're supposed to be talking about and what they should not talk about, and refer someone to a different person in the organization, or refer the media to a spokesperson. Beyond that, just knowing how to prepare key messages and having up-to-date statistics, backgrounders on your organization that you can hand to the media when a crisis hits. But interestingly, a new chief of communications started the week of Katrina at LSU. So the head person in charge of communications, that was his first week at LSU, was Hurricane Katrina. So that actually speaks to why it's so important to have a crisis communications plan. The person in charge was new. He didn't have media contacts, he didn't know the area yet, and so the people that had been at LSU and had been working really had to rely on their established media contacts, their ability to deal with the media, knowing the needs of their consumers, updated email lists to be able to reach students and parents, bringing in employees from around campus to set up phone banks and information centers. So they were able to execute their crisis plan, and they were able to really handle the situation well, with a lot of really positive media coverage for the organization and meeting the needs of lots of people. Most of the organizations we talked to were really trying to archive and save all the clippings from their media coverage and all the news releases they were sending out and copies of emails, so that they could go back and evaluate